Hello everyone, I am Dr. Netafan Zada, plastic and rhinoplasty surgeon in Istanbul in the Zane Clinic. As we know, rhinoplasty is the most common aesthetic procedure last times. Today we will talk about rhinoplasty and we will give general information about this procedure. What's a rhinoplasty? Rhinoplasty is also called nose job, which operation we can correct and reshape nose, external nose, and at the same time we can correct nose bridge through nose. Which techniques we are using in this procedure? We are doing it by two ways, open techniques and closed techniques. I prefer open techniques because I use it a lot of patients, but of course at the same time we are doing it closed techniques. Closed techniques, it means that we are doing all this procedure, all these operations through nose. But open techniques, patient has scar and incision before the nose. At what age we can do rhinoplasty? Rhinoplasty we can do patients who age above 18, but also at the same time we used it a lot. Patient was 18 until 25. But at the same time we are doing above 15 and 16 years old patient also. But it is the most common aesthetic procedure and young patients prefer it. The most suitable candidates for rhinoplasty. It is the most common questions also. Most suitable candidates for rhinoplasty is a patient who has difficulties to breathe through nose, at the same time has history of trauma in the past, and external nose has multiple deformities or others. It is the most suitable patient for rhinoplasty. What's the disease or problem treated by rhinoplasty? Which problems we can treat by these operations? If patient has external deformity, especially external nose, and nose is not suitable for his face, in this case we can do this operation. Is rhinoplasty painful? Rhinoplasty is an operation we are doing under general anesthesia. In this process, in this period, patient didn't feel any pain, but after operations, it is also not painful, a painless process. Patient can't feel any pain, and if they have any pain, any dizziness or some problems, we can correct it by medication. But it is totally painful. Is there need to stay in the hospital after the operation? It is also most common question. Yes, some surgeons didn't take patient in the hospital, but I am taking them one day at the hospital. Does rhinoplasty only reduce size of nose? Not only reduce the size of the nose, at the same time it is a process which we are doing reshaping, recorrection at the same time. And at the same time we can reduce the nose if patient wants it and if their nose need to reduce the size. And when was the stitch removed after the operation? After the operation, my patient, I remove stitches and tampons after 1 week. But sometimes we are doing it after 5 days. And external fixation and tampon at the same time. But after 10 days or 2 weeks, the patient should avoid from hot water, hot drinks or something. What are medical advice that the patient should follow before and after operation? First, before operation, we advise them to avoid anticoagulant medications and upper airway infections or others. After operations also, patients should avoid hearts and at the same time to lift heavy things or others because it is increasing risk nose bleeding. Last questions. before the operation is possible, know the shame that the nose will look the after operations. Yes, it is possible. Patient can to see it by Photoshop programs, but they should know that it is not final nose. It is only program and we can reshape before operations. Most of questions that are you doing here these operations? Yes, we are doing here these operations very successful, very good team. And we are examine patient before operations, also follow up patient after operations. It is most important for us, and we are doing this very carefully. We are examine patient by endoscopic examination, and after patient we will follow. And patient should know that healing process depends on patient skin, patient skills, and of course operation technique or others. And it takes minimum 6 months until 1 year.